Welcome to Scrub In, a podcast where purpose meets care. We are more than just a podcast. We are real stories of hope, expert health advice, and inspiring conversations with the people behind the scrubs.
This podcast will leave you informed, inspired, and reminded of the purpose that connects us all. It's the voice of humanity in healthcare, uplifting, honest, and full of heart.
Featuring hosts Dr. Kendall Barton, Keisha Morris, and Alice Rausch. You can listen and subscribe on Apple Podcasts, Spotify, Google Play, and YouTube. Or visit bayhealth.org/scrubin to learn more. Now, let's scrub in. Here's our next episode.
Welcome back to Scrub In.
Today we have Dr. Barton and Alice hosting.
We want to thank our new and returning listeners and mention our last episode where we talked to Trish Bentley, who was one of our nurse navigators. We talked about breast cancer awareness. It's a great episode. If you haven't checked it out, please do so.
For sure. And we're going to jump right in today with our quote. The good physician treats the disease. The great physician treats the patient who has the disease. And that is by Sir William Osler.
A good one.
Yeah, great one. Absolutely, and one that definitely applies to our conversation today.
Absolutely. Today we are talking about patient advocacy with our guest, Dominic Kayatta. Thank you so much for joining us. And patient advocacy sounds just like a fancy title, but can you explain to us what that means?
Sure, be happy to. And first of all, thank you for having me. Very excited to be back on this wonderful podcast. So patient advocacy really is being that patient partner, but not only to the patient, but their caregivers, their family members, to best navigate all aspects of their care to get the best possible outcomes.
Absolutely. And there's so much that you do. And we're excited to have you back again to share all of that information with our listeners.
All right, Dominic, so tell us a little bit more about yourself.
Sure. Thank you. Again, my name is Dominic Kayatta. I'm a Senior Director for Patient Experience. Been with Bayhealth now 2.5 years. As I like to say, best 2.5 years of my career. Love what I do, get to do what I love every single day. And my background is actually in behavioral health as a psychotherapist for a whole bunch of years, which I find the perfect training ground and background in this whole patient experience / patient advocacy space. Originally from Harrisburg, Pennsylvania, but in the late 80s, moved down to Newark, Delaware, where I fell in love with the state as well as fell in love, and have been married to my wife for 31 years now. And we have 2 adult children that are twins, Nicholas and Sophia, who are now 25 years old.
Awesome. Well, congrats on that. 31 years. That's remarkable.
Thank you.
So do you have any hobbies outside of work?
Yeah, that's a great way of putting it. So try to work out, even though it doesn't show all the time. Try to get in the gym at least 4 to 5 times. And because of my commute, one way, typically about 55 minutes, I love listening to audiobooks as well as podcasts as well. The other big ones are just spending family time. That's the top priority. And as part of that, doing a lot of traveling with them. Our adult children still like hanging out with us. So we at least go on 1 vacation, if not 2, as a family unit per year.
Sign of great parents.
Thank you.
That's awesome. If you ever have any extra room on those vacations, let us know too. Just
He would like to go to New Zealand.
Okay.
love to. Yes. So if you're planning that in the future, let me know.
You got it.
A little bit about, that's an amazing background to have in the behavioral health. What got you into the healthcare space to begin with?
Yeah, I think for me, it's the passion, right? This is the noblest of all professions. What we do in any given day, people coming to us at their worst, the most vulnerable, and we get the privilege and honor of creating that space of hope and comfort and hopefully great outcomes to have them return to their quote unquote normal lives feeling a little bit better. That has always been a passion, to partner with patients, families, as well as all team members to create that environment.
That's awesome. And when you speak about creating that environment, tell us a little bit more about what your motivations are for that.
Yeah, motivations, and I start with my own quote here. It comes to us from Martin Luther King, And he says, everybody can be great because anybody can serve. And he goes on to talk about you only need a heart full of grace and a soul of love. And I think that's all we need. And if we stay rooted in that, in all of those interactions, we're going to create that space where it's truly humans taking care of humans. So by us showing our humanity, bringing our whole self to those encounters, we create that space where our patients and families can also bring their whole self, because as the quote says, if we treat the entire patient, that's where we make the connection. That's where we get great outcomes.
It's so interesting to have the two of you here in this space, your professional background in caring for patients, and then your background in helping to, guide them through the healthcare process.
Yeah, I think it's a great team dynamic. Like you said, it's our primary job to care for the patients, but in that same light, we also need our patients to care for themselves.
Yeah.
And you guys are a great resource for that. So we really appreciate all that you do.
Thank you. Yeah.
So what is one of the, you get a lot of questions, we know, all the time, and you see everything that happens. So what is one of the most common things that you hear from patients?
Mm-hmm. It'd be a couple things. And again, really depends on the setting. From the inpatient setting, because there's so many people involved in the care of just one patient, all these people in and out of the room, a lot of times that can lead to some, I wouldn't say miscommunication, but not necessarily always aligned. So the big question is, who's the captain of my ship, right? I had this doctor come in, I had this specialist, this consultant, who's calling the shots ultimately, and how does that impact my treatment plan and then ultimate discharge? So it's really helping them understand who is coordinating all of that care. Big first question. Secondly is, now what do? I got this after visit summary. What does this mean? What's the priority? What should I be doing? Exactly what you said, Dr. Barton, and now taking care of myself from this point forward so we avoid me coming back into, be it an inpatient or the emergency room. Yeah, and the last thing is, and it's one of the questions on our surveys, as you know, very attached, even though we're not teaching to the test, but explain things to me in a way that I can understand. So it's translating all those documents, everything that's been shared with me. Can you just say that in layman's term? And how does that now impact next steps in my care?
And we actually spoke about that a few weeks ago with Dr. Edler when she was on, about what can patients do to feel comfortable to ask those questions when they don't know the answers to them. So having those resources and individuals available who can make patients more comfortable in those situations is invaluable.
And Dominic, I know you're busy, so people know how to find you, but there may be some people who have never felt like comfortable advocating for themselves or finding our patient experience team. How can they reach out to you?
Absolutely. So on all of the documentation, what they get as being admitted to any one of our services, part of the handbook, list all the contact information for patient advocacy. It's out on our wonderful bayhealth.org site, or they can just call the operator at any of our campuses and they will be connected to patient advocacy. And we are truly there for you. And again, if someone can't pick up the phone because, as you can imagine, just a little busy, someone will get back to you as quickly as possible.
One of the things that we've been working on is being more transparent as an organization, and a project that's kind of going on behind the scenes is the MyChart bedside launch, which is through our Epic system. And can you talk a little bit about how that may enhance the patient experience?
Absolutely. When you use the word transparency, for me, that signals trust and partnership that we need to have with our patients and our caregivers and family members. This will take it all to a new level in real time. When you're in your bed in any one of our 2 hospitals, you're going to be able to see your plan of care for the day with a kind of loose schedule. We don't want to nail it down to a specific time because there's so many moving pieces in healthcare. When you're going to get your medication, when you're going to be seen by your physical therapist, if you're scheduled for a procedure, the approximate time that will happen, and any other tests or services that you're getting. You'll also, too, get to know who your care team is. As I already alluded to, so many people in and out of the room, who's in charge. Now you'll see it in one spot. And where we have pictures available, then you can put a name with a face, because again, a lot of faces inside, as well as, just as importantly, your medications, which will describe why it was prescribed you in the first place and what are the side effects and things you should be watching out for. And then as part of that function, a big thing is so many people don't have family in the area, or they're working full time, so they can't make it to see the doctor or see, lay eyes on the patient. So you can actually give proxy to a family member that can't physically be there, so they can track everything that's happening while you're in our care. So I am super excited about this option we're going to have for our patients.
It's like you found a way to multiply yourself.
Exactly.
It's what it came to mind when you mentioned this is one of the biggest questions I get, and for patients to be able to see that so clearly, hopefully by downloading the MyChart app and having it accessible when they're here, it will just help you and it will help everybody just care for the patient, which is ultimately what we're trying to do.
Exactly. Well,
Yeah, that is awesome. I don't even work in the hospital anymore, but I'm excited for it. So that's going to make patient experiences exponentially better, I would imagine. So looking forward to the launch of that. And we've spoken a little bit about on the inpatient side of things, but kind of shifting to the outpatient side, if you don't mind for a minute. What are some practical things that patients can do before one of their appointments or before a surgery to better prepare themselves, educate themselves for them and for maybe a loved one as well?
absolutely. Yeah. And again, in total transparently, we can appreciate and understand our access issues and people unfortunately having to wait months to see their specialists. So with that in mind, to maximize that time together, first of all, follow through on any test, blood work, x-rays that the doctor will need as part of developing their diagnosis and treatment plan. Make sure you have that and have it plenty of time so all that information can get to the right people. That's what we really educate and coach our patients. And if they're seeing obstacles in that, give us a call back. We'll see if we can get your appointment moved up to have that blood work or that x-ray, whatever the case may be. Secondly, because those appointments go really quick and you're given a lot of information, write down all of your questions ahead of time and bounce them off of somebody else that might not be familiar with your diagnosis, if you feel comfortable sharing that, because they might have some very basic questions that you'll be like, I never asked the doctor that. So bounce those questions off, write them down, and where all possible, if you can, have a support person with you, because they're going to pick up on things that you won't, because so much information's covered during those exams or appointments, whatever the case may be. And then just as importantly, what am I going to do next? Can we summarize? Can you explain that? And if you had to prioritize, what should I do next, doctor? And then make sure we're on the same page with that.
So if someone ran into an issue and didn't know what to do, they could literally find your information and give you a call. And would you be able to guide them through that like you just did with us here?
Absolutely. And we have on occasion, maybe I shouldn't put this out there, in some situations where the patient has given us permission, we've accompanied them on some appointments. Either because it was a relationship issue between them and their physician or the office staff. We just want to ensure a smooth appointment and that all communication barriers are eliminated so we can have a great outcome. So we've had to do that on several occasions just to make sure, or we can give them resources in the community. There's a lot of people out there that are kind of the quote unquote public patient advocates that if you truly don't have anybody else in your corner, you can employ their services and they will accompany you to your appointments.
That's awesome. So I think something that we run into a problem in medicine right now is when, a patient's maybe not been seen by a doctor in a while and they come in and maybe they're diagnosed in the hospital or in the outpatient setting and they're just overwhelmed. There's so much to do. They don't even know where to start, let alone advocate for themselves. So for those listeners out there that are like, I don't even know where to begin, what do you say to them?
Yeah, absolutely. So that's something that if they're a patient of ours, we can directly get involved as patient advocates to help them really go through all that information and kind of how to prioritize, or if they do have questions, here's the next step. I would also, enlist those public patient advocates to do too. But sometimes it's just a call to the office too. They can sometimes help clarify because they know the processes inside now. Here's what you need to do. Here's the order of that. What other questions? And here are some resources. What I'm really excited about because of the MyChart bedside, because they're given a lot of information about their diagnosis, about their condition, their disease, and those next steps. That'll be available to them once they leave the hospital, so they don't feel like I gotta get it all now. They can refer to it. We're hoping to do some patient education, send links for videos that'll educate them more on their disease and how to manage it. Then it's a comprehensive, multi-pronged approach instead of just relying, oh, I'm not going to know anything until I see my doctor again. We want to fill those gaps in very quickly.
Yeah. And to emphasize, we want them to download the MyChart app, and then it will automatically just launch once they're in the hospital. So they don't have to do anything more for MyChart Bedside to start, but we do need to get patients and community members to download the MyChart app.
Yes, please and thank you.
We will put a link to it in our show notes.
Yes. And if you have problems, the numbers on there are actually great. The IT support for MyChart is fantastic. I've had them. I've pulled up during patient appointments before to help guide them through, to help out with issues. So they're local on site and they do a great job. So for any patients out there who are struggling, call the number.
Our IT team is great.
Yes, they are.
Well, we've talked a lot about information in general, but what about one of your good stories you've got for us?
Yeah, and I've shared this one before, but I think it really highlights the importance of exactly, first of all, the quote that we started this whole thing with, but that connection with really educating not only the patient, but the family member and those decision makers. And I'll never forget it. It's happened 2 organizations ago when I was in charge of what we call patient relations at the time. And my phone started blowing up at 5:55 a.m. as I'm driving into work. And it's the manager of the OR saying, Dominic, you got to get up here right away. And I was like, okay, this is going to be fun. And my follow-up question is, so who's the surgeon on the case? And they let me know that name. And I was just like, oh, this just got even more interesting. So I hurry up. I don't even remember parking the car. I just run right up to the conference room where they were all meeting. On the left side of the conference room table, there's the family, the spouse, the husband, as well as the adult children. On the right-hand side are the OR team. And then a few minutes later, surgeon comes in. So it's like, okay, just take a deep breath, Dominic. This is going to be okay. So he comes in a little brusque and says, what's going on here? I got my patient on the table here. Why aren't we operating? And the spouse said, I just don't feel comfortable with this doctor. She can't speak for herself. And this is a lot of me. I don't think she needs the surgery. So the doctor did a brilliant thing. I just saw the whole energy change in the room. And he said, can I ask you what you do for a living, sir? And he goes, yes, I am a master mechanic. Oh my gosh, what a noble profession, right? I wish that's something I could do so I could fix my own cars. So he went on to make the analogy of the heart with the engine. And after that, and really explaining things in a way that the spouse could understand. Spouse stood up and said, what are you all doing in here? Get in there and I'll get on my way immediately. And it was a great outcome. But what came from that was so many lessons in terms of connecting with your patients, and in this case, your caregiver, in a way that's first of all meaningful. I have your loved one's best interest in mind. Secondly, explain things in a way they can understand. So find out what's important to them, maybe a little bit about their education, what they do for a living, and then explain things in a way that they're going to get that, and not only get it, but the importance of why your wife needs this surgery and needs it immediately. And then they were fast friends for a long time. So you make that ongoing connection and relationship. And I'm sure that individual, as well as the whole family, really spoke so highly of that surgeon and the healthcare organization.
That's awesome. We really appreciate you sharing that. We love to hear the good outcomes
Yes,
in medicine, especially when there's a little bit of tension in the beginning, because it doesn't always end up great for the patient or the provider.
exactly.
Hearing you tell that story reminds me of hearing you teach us. And I mean, we're talking about so much of the external work that you do for the community and the patient, but you are also sharing your experience with our team members in order to, improve the experience for our patients from the inside out. Can you talk a little bit about that work?
Absolutely. Well, we just concluded our Committed to the Patient Experience class, which covered 5 of our patient experience tools to make those human-to-human connections and make sure our patients understand what's happening every step of the way. So we rolled that out for all team members to include physicians and clinicians. And that just wrapped up in September. We educated 4,802 of our team.
That's incredible.
So it was very exciting.
Well done.
And I had the opportunity to recognize and debrief with all the faculty that helped me do that, because obviously I wouldn't be sitting here if I had to run, over 185 classes in 12 months. And the biggest takeaway from them is they were so impressed with the passion and the level of care all of our team members, regardless of what's on their badge, clinical, non-clinical, have towards serving our patients. And they are now able to network and appreciate where each other's coming from and have a new appreciation for what it takes to be a clinician, to be somebody in marketing and communication, somebody to be in environmental services. So it was a whole different level of appreciation and connection, because ultimately that's what our patients and families want to see. As we know, a key driver of that loyalty and that likelihood to recommend is, did the team work together for my care?
Yes.
When we make those connections, they're going to see that, they're going to feel it, and they can trust in the care that we're providing.
Absolutely. Yeah, I mean, you'd like to think that everybody on your care team has got the same goal in mind, or birds of a feather, and so to bring it all together like that, from across the board, top to bottom, is awesome.
Is there anything else you want our listeners, our community, to know about the work you do?
Certainly I do. Thanks for asking that question. I think at the end of the day, it's a new day, right? I refer to this time period as the COVID hangover, right? And patients are more sick or more complex, and nobody's fault. It's just a reality of that break we had to take, and just the apprehension of coming back into our services, because am I going to be able to keep safe? Very fair assessment. And I talked to a lot of people during COVID about that very dynamic. So when they did come back, as well as what we're experiencing here in Kent and Sussex campus, let's put it in context here, a population explosion, right? Everybody wants to come to the first stage and retire. I can't blame them.
Some want to come here to work too.
And they want to work here too, looking at those, longer term plans. So I love that. However, that has caused a logjam due to people putting off care, as well as just the population growth. With that in mind, I think it's really important that we focus on the human-to-human care. And when you are in our services, just ask, what can I expect? Is this the right level of care for me? Because our goal too is ultimately get people to the right level of care as quickly as possible. So does everything need to be an emergency room visit? Or can we go to urgent care or a walk-in and then figure out what next steps, or a call to your physician's office? Here's what I'm experiencing. Really don't want to go to the ER. What other options do I have until I can be seen? Because we don't want people sitting in a waiting room for 8, 9, 10 hours in pain when we're not able to address that as effectively as we'd like, coupled with all the other factors that I just mentioned. So really, my call to action here is educate you on the right level of care at the right time. And if you're unsure, call Patient Advocacy. We'll make the connections for you, so you don't have to suffer and you don't have to be in a waiting room for 8, 9 hours.
Well, Dominic, it has been an absolute pleasure having you on, and we want to thank you again for being on here and being able to educate us as well as our listeners.
Yes, thank you. It's been a great conversation. Thanks for listening, and tune in next time.
Thanks for listening to Scrub In, where we bring purpose and care to every conversation.
If you enjoyed today's podcast, don't forget to subscribe, rate, and review on Apple Podcasts, Spotify, and wherever you listen.
Stay connected, stay informed, and stay inspired right here with Scrub In.